Enloe Medical Center prides itself on providing world-class medical care close to home. That means working with highly skilled caregivers and bringing new technologies and techniques to the North State to help patients heal faster so they can get back to what they love most. One of these advances is the addition of the robotic-assisted surgery. Since its debut at Enloe in June 2018, over 1,100 surgeries have been performed using this tool, and soon Enloe will have a powerful new device to help in the fight against cancer. Hello everyone, I'm Susie Lowry Hall. I'm Enloe's Community Outreach Manager, and I'm here with Surgical Oncologist Dr. Keith Cavaness to talk about this topic. But before we get started though, please remember that the information we're about to share is not intended to be medical advice. If you have specific questions about your health, talk to your provider. And as always, feel free to post your questions in the comments field. We'll do our best to answer as many as possible during our broadcast. And with that, let's get started. So, robotic-assisted surgery. What does that look like?
So the robot is made up of several different pieces of equipment. One of them is a console, and that's where the surgeon sits and operates the robot. And he uses a couple of what we call joysticks, more or less, for him to put his fingers and move the arms of the robot. There's a piece of equipment called the cart, where we have most of the electrical equipment and the cautery and the inner workings of the robot that we can see video on. And then there's actually the robot that we push up to the bedside of the table while they're asleep. So those pieces of equipment are positioned kind of strategically in the room so that we can bring the patient in and put them on the table. And then the surgeon, after we start the procedure, will prepare the patient, and then he actually scrubs out, which means he takes off his sterile gown and his gloves, and he actually walks over to the other side of the room and sits at the console. So the console is set up so you can actually be working on it. You're looking inside the console, inside the patient when you're doing your operation, but you're actually able to pull your head out and look and still see the patient, and so that you're always in contact. If there's any kind of issues, you can be at the bedside very quickly.
That's really helpful. I think a lot of people, when they hear robotic-assisted surgery, they think that you're going to just shake their hand and send them in to go see a robot, which is not the case.
Exactly.
So what are the benefits to this surgery?
So robotic surgery is, and some people like to call it robotic-assisted surgery. Really what it is it's another type of minimally invasive surgery. So minimally invasive surgery means we try to do smaller incisions to do the same kind of operations. The smaller incisions really come into play when we're talking about doing big operations on people where normally they would have a very large open incision. In bigger incisions, there's a higher risk of infection, there's a higher risk of hernia, the recovery takes a lot longer because of the soreness of the muscles and everything. Smaller incisions, not to say that it doesn't hurt, but the smaller incisions, actually the pain is significantly less, the recovery is much quicker. Patients feel like they're getting back to their normal, their normal activity in life much, much quicker.
Now, robotic-assisted surgery is not for everyone. Who would be a good candidate for this type of surgery?
Robotic-assisted surgery can really help with a lot of different conditions, and that includes benign things that are done more frequently, like fixing hernias, taking gallbladders out. In fact, this week I think I had a couple of different operations. One of them was fixing a hernia. One was taking a gallbladder out in a lady who had previously had a lot of infection in her gallbladder, and there was a small concern that she could have a cancer there. And using the robot to do a procedure like that helps us to be very precise and take it out safely, but also reduce the risks of spreading any cancer.
It's incredible. Yeah. That's exciting stuff. So speaking of exciting stuff, I understand that there's a new tool coming that will help fight against cancer. Can you tell us a little bit about that?
Sure. So the Cancer Center has invested in a great new tool that I think can help guide radiation and treat certain kinds of cancers. So it's been, we've known for a long time how effective radiation can be at treating certain types of cancers. And in this case, the radiation needs to be guided very, very specifically to the certain area of the body to minimize side effects and minimize complications. And this new MRI linear accelerator that the hospital has invested in is something that can provide really excellent radiation therapy to patients and radiation treatment to patients with minimal side effects.
So that brings me to how does it feel to be a doctor here in our community, knowing that we're going to have all these cool new tools to meet the needs of our community?
It's pretty exciting. I think, when we look at where we are in this community, It's a smaller community. Some people say it used to be a farming community, and maybe we've grown a little bit, but for the most part, we feel like it's still kind of a small town feel, and that's why we like being part of this community. But the things that we have here in this community to be able to treat patients is really, it goes far beyond what this kind of community would normally have. We have a lot of really kind of advanced care. We have excellent physicians at the Cancer Center who have been trained in a lot of these newer techniques, and so they're bringing that care here locally so that we can really provide excellent overall care for our cancer patients at the Cancer Center.
Well, thank you so much. That's all the questions I have for you today. I appreciate your time.
Thank you.
And thank you for watching. Join us next month for our next discussion right here on Facebook.